and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And together we are the
therapist.
most famous physical therapists on the internet.
In our opinion, of course, Bob.
Okay, Brad, today we're going to talk about how to pop or crack your own back safely.
Okay.
And by the way, when we're going to talk about things like this, we're going to put forth a little bit of a disclaimer. If you're having back pain, you should get this all approved by your doctor, physical therapist, or chiropractor. Make them sure, maybe show them what you're going to do first before you do it.
As a matter of fact, if you're having back pain, I'm going to say
don't even try this. Right.
This is
definitely if you have a herniated disc.
Oh, yeah.
And we're going to show you some things at the end you can try for a herniated disc.
Right.
So, the whole key to popping or cracking your own back is that you're looking for a relief. So don't always be focused on the sound.
Right.
Sometimes the sound's not going to happen, the crack is not going to happen, but you still may get relief. So, right, Brad?
Yeah, the sound, I think, is a lot of psychological benefits that you hear it and you kind of feel a little bit and you just think, oh, that must have did something good because it usually feels good.
So when we say we're going to do it safely, what we mean is basically we're going to show you a stretch that may lead to a pop or a crack.
Right.
So it's a gentle stretch.
We are not showing mobilizations or
manipulations
that chiropractors and therapists do. This is just stretches that a lot of people do every day in the gym.
All right, let's get started, Brad. Let's start. First one is to just get a real good solid back chair. You don't want one of these chairs that's flexible. I mean, and generally it needs to hit you on a certain spot, usually in the mid-back.
Right.
This is more of a mid-back stretch.
Right.
So, and if you want to make it a little more comfortable, you can put a towel over the edge. And very simply, you're going to get your butt back in the chair and you're just going to stretch up over the chair. And you may get the pop, you may not.
Right.
And I just did. But you can also put your hands like this and stretch back. And let's show another variation, Brad, with the ball.
Well, and I think with that one, you do it like Bob did. You're not going to go bouncing on it.
Yeah, don't bounce back. Just gently stretch back, and you'll get the pop.
Yep, and if it doesn't, forget about it.
The ball's right there, Brad. This is one that I'd like to say that we invented, Brad.
Well, I can't take
it, but one of the guys that works for us invented it.
One of our therapists, yeah.
So if you have a chair that is really high and it isn't going to work, you just get one of these little soft balls. I don't know, what do they get them at Walmart or something like that?
Yeah, yep. You can,
and you can just lean over this. And what's nice about this, Brad, is you can put it up in different spots.
Now, Bob's a taller guy.
Yeah.
If this chair was up higher,
I can go higher,
Right.
I can go a little bit lower, and you can find the spot that you can stretch over, and maybe you'll get a little bit of relief that way.
Sure.
Sometimes doing these repeated, by the way, Brad, even again with no popping or cracking, if you do like 10 of these, sometimes you start getting relief.
Right. Get some.
All right, as a different version of that, Brad, is you can actually just take your hand and make a fist like this. And I'm going to put the pressure on the thumb right here, Brad.
Yep.
And I'm going to put my hand back behind me like this.
Yep.
And I'm going to push up, and then I'm just going to gently stretch over it.
Yep. So he's
Okay?
going like this.
Yep, and I can go on different levels. I can stretch over it very gently.
I just got mine to go.
Yep. You can go off to the side. You can go off to the side a little bit.
That's where I got mine. I went off to the side.
Or I can go off to the other side. Again, gentle stretches. We're not pushing and cracking.
Exactly.
We're just gently going back.
You're not going to have your friend help you do this. This is something you do on your own. If it goes, it goes. If not, that's all right.
And what's nice about this is, after you've done some bending like this, quite often your back needs to be readjusted the other way, so you can just stretch it back the other way.
So, sometimes if I'm at my computer and I got my glasses on, it forces my bad posture. I'll do one of these things coming up with the roller that we're going to show.
All right, let's get the foam roller, Brad.
Really helps.
Which one do you want to use?
I like the blue one.
All right, this is a softer foam roller. You can use any one of the foam rollers.
Right.
I mean, harder, but these I think are more comfortable. This is from OPTP.
Called the medium or low density. They're more comfortable. I can guarantee you like them. But I do this recently quite a bit. I got to get my glasses adjusted so my head's not forward so I can see the screen. Anyways, my posture's been bad. My back is paining. I've got some pain right here. And I'll go on the living room floor. I'll get on my...
Just a gentle roll and stretch.
Oh, there it goes. And usually I'll go like this. And I'll just relax. And then it went, ooh, did you hear that one? I did. Boy, that was kind of nice.
Cracks through your ears. Now, as a little variation of this, Brad, is you can turn the roller too
Sure.
at an angle like this.
Yep.
And it's going to just get a little bit different part of the back when you roll. It's going to,
Oh, yeah.
and you can also go the other way.
Just wait, Bob. I'm not
Okay,
done.
you're not done yet.
Yeah, I actually haven't done this particular technique yet, but I can see where it could be helpful. I'm going to...
It may get a little rotation in the back.
Yep.
So, you know, again, gentle stretching, not doing anything drastic here.
No, Bob, there's some people who probably may not have seen our channel yet.
Oh, yeah.
We should give them some information on
Yeah,
that.
if you haven't already, you know, you haven't subscribed to us, our subscribe button is right here. We upload videos, right here on the screen.
right.
We upload videos every day, 7 days a week, and they're all on how to stay healthy, fit, and pain-free, and you don't want to miss out.
Exactly.
All right, let's show another one, Brad. I'm going to
Sure.
show one laying down here. Again, this is a stretch, and this one, again, you definitely don't want to do if you're having pain or you're having a herniated disc. But
Right.
you're going to start on the side, and generally, you're going to have one side that's, you know, well, you don't want to have any side that's painful. You want to make sure when you do this, it doesn't hurt.
Sure,
So
exactly.
you can start off, you can put the one leg straight, and the one that's on top, you can hook behind the leg
Right here.
like this, and you can go at different levels. The higher you go up, the higher it's going to stretch on your back.
Sure.
So if you're down here, it's stretching more of the low back. You get up here, it's stretching more of the upper back. And while you're in this position now I'm going to actually turn my shoulders, and I'm going to go into this gentle stretch. I'm bringing this shoulder forward. You see how I did that, Brad?
Yep. So this shoulder slid forward.
Slid forward. I'm getting kind of flat on my back up here, and I'm bringing this shoulder down. And now with this in this position here, you can just kind of just gently rock back and forth. And you can even give yourself just a little extra pressure here, a little stretch. You can grab here too, Brad.
Yep, work
Either
on the
way,
hip.
and just give a little stretch. And you can do this on both sides. It's a good way to, you know, increase your rotation.
Sure. And I think
So-
it is good to do both directions.
All right, Brad, now let's say you are having some difficulty with a herniated disc, or let's just say you're having back pain and you don't have spinal stenosis, you don't have spondylolisthesis.
Yep.
This is a good stretch to do. You know, this is a universal one that
Right.
for the vast majority of people, it's going to be a good one to do. And this is, you know, based on the McKenzie method or McKenzie system. You're going to go ahead and start in a prone position here, what we call laying on your stomach. And you can even start just by laying here and relaxing a little bit. Then you can get up what we call prone on elbows. And you can just, keeping the bottom down, right, Brad?
Right. So we're getting that. Bob's got, for a 55-year-old guy, you got a good arch in your back, Bob.
Don't lowball me, Brad. I'm 56. So,
Oh, sorry.
okay. You're going to put your hands now underneath the shoulders, and you're going to go ahead and just start gently doing stretches like this.
Right.
And you're going to keep the bottom down. You keep your pelvis down.
This here.
And you're going to go up as far, you know, as it lets you go naturally. Don't want to be pulling up your pelvis
Right,
like this.
right.
So you're going to go ahead and stretch up further and further if you can. And you know, eventually you want to see if you can get all the way up without the pelvis coming off the ground.
Right. If you're doing these and you do 5 or 6 of them and the pain gets worse or you get more pain down your leg, do not continue.
So an advanced version of this, Brad, would be to now, you know, let's say that's been going well, but you're kind of stuck here. It doesn't go any further. Then you might actually take a sheet. Do you want to grab a sheet behind you, Brad?
Are we doing the one under the hip?
Oh, yeah, we can do that.
Oh, I know what you're talking about.
Otherwise,
yeah.
I was going to just for overpressure.
Yep. Oh, we should have.
Sorry, we should have thought of this first.
That's all right, Bob.
Well, let me show you one while we're waiting, Brad.
No, I got it, Bob. I
Oh,
got
you?
it. Yep.
Look at this, how fast he is. You can take a sheet or a belt, and you're going to put your hands in the same position underneath your shoulders, and you're going to lift up like this. And now you can see how that's giving me some counter pressure, Brad.
Yep. Support right in the low back.
And that's giving you another excellent stretch. You can move it up a little bit and work different parts of the back.
They should feel good while you're doing them.
These are always something that are going to be pain-free. You know, you don't want to be increasing your pain. And what you'd like to see with sciatica, actually, is that the pain's coming up the leg and going into the back.
Right.
And not you know, going the opposite way. Now, another way to do some of these press-ups, some variations, is to actually do what you call the roadkill, right, Brad?
Yep.
So what I'm going to do here, I'm going to actually bring my leg out like this.
Yep.
And usually you start by laying here first, Brad?
Yeah, exactly. I just had someone yesterday, a patient, trying to get the pain out of his leg. It was kind of working. I said, move your leg up like this, and he did. And immediately said, oh, that feels better. And I knew right away that we're onto something.
Did you have him do some press-ups with
Yes,
it then?
I did.
So then you can also have him do some press-ups with them in this
Right.
position.
And his calf pain started to get better as he was doing them. I was smiling, and so was he.
A variation of that would be to take a towel. Do you want to take that roll towel maybe, Brad?
Sure. I was wondering where I put that.
And you can actually put that under your pelvis right here.
Yeah.
Same thing. See if it helps relieve the pain a little bit, and then try some press-ups like that.
Yep. It just
So-
changes the angle of the back.
Right. All right. Well, I hope you're pop and crack yourself to a prosperity here.
And have some good health. And I don't know, Bob, what else can we say?
Well, we can fix just about anything.
Except for that broken heart.
Yeah.
Catch this, Lonnie.
All right. Thanks.